Had you thought about being a public company before you were approached by Eli and Keith?
Yeah, we were beginning to explore how we may want to enter the public markets, kind of leverage the energy that's in the public markets for this kind of space. And like Eli, I had never heard of a SPAC up until catching up with Eli and hearing about his SPAC. And yeah, it was just an amazing opportunity to leverage as a vehicle to go public.
Yeah, it's funny. I mean, it just makes me laugh about, all of these people, you and others, even, very well and successful long-term investors are first learning in some respects about this brave new world that we've entered into with SPACs. We have a couple of indices here in which we track the SPAC activity, once it's formed and once it does a deal, which is interesting in and of itself. What's the practical application? What can you tell our viewers, Eric, and really the investing public, that's who our viewers are, about what this company does, why they should be an investor in what Sema4 is going to do in the future?
Yeah, it's really all about, the way I think about it is AI-driven standard of care. So AI is the standard of care. How do we harness all of the information that technologies like next-gen sequencing can produce on patients, integrate that with the medical records around patients in partnership with patients, in partnership with a physician, compute on those data, derive the most meaningful, accurate insights, and then a way to communicate that back to physician and patient in a way that facilitates clinically actionable decision-making. So it's how to tie all the pieces together, whether it's the generation of the data, the interpretation of the data, the conveying of that information, and the standard of care to improve outcomes for all.
What are you going to use the money for?
So the money, so the proceeds, it's going to be how can we move bigger, better, faster? Like so we have a standardized genomics platform that for health systems can standardize the use of genomic information across the spectrum of disease, an information platform that, again, facilitates integration of that data and insights derived from that data and conveying it to physicians and patients in a meaningful way. So it's about, what are the gaps in this platform? How do we want to fill out the genomics platform with additional technology that we now have the fuel to go out and acquire as opposed to build on our own? How do we enhance our ability to acquire and manage and scale, harmonize data across multiple health systems and so on? So it's all going to be how to accelerate and increase adoption, the rate at which we can drive into a health system, again, in partnership with physicians and patients to provide more holistic solutions.
Well, I appreciate the time that you've spent with us. Congrats to you on the deal today.